We have a parenting alert now. The U.S. Surgeon General has issued a new advisory on a growing youth mental health crisis, warning that depression and anxiety in young people have doubled worldwide during the pandemic. Let's talk about that with emergency physician Dr. Darien Sutton. Dr. Sutton, thanks for joining us again this morning. Break down what we see in this report.
Well, good morning, George. These are some incredibly concerning trends that we're seeing in the trends of adolescent mental health. What it seems as though is that children, adolescents, and young adults are facing considerable challenges that are augmented or exacerbated by the pandemic. In a recent report covering 80,000 youth globally, it found that symptoms of depression and anxiety doubled during the pandemic, with 25% of youth experiencing symptoms of depression and 20% experiencing symptoms of anxiety. Also, ER visits for suspected attempts of self-harm have increased by over 50% among girls. So this is an incredibly important and needed discussion to have right now.
It is, and there's a pretty wide disparity in access to help.
Absolutely, and that's one of the most striking factors that we see in this report. It identifies young groups that are more vulnerable than others, which include young people of color and young people who identify with the LGBTQIA+ community. And the access seems to be the primary issue, access to diagnostic testing, to therapy, and to pharmaceutical intervention. So hopefully this will increase funding to mental health programs, as well as access to these communities in need.
What kind of signs should parents be looking out for?
You know, I try to remind all parents that each and every person can present with mental illness in different ways, but some key symptoms that you should pay attention to, specifically regarding depression, are excessive sleeping during the day, a lack of concentration, frustration out of proportion to the cause, and a decreased desire to participate in activities they would normally enjoy. These are some of the symptoms, and I also try to remind parents to trust your gut. We often have inclinations that something is wrong before it becomes obvious, and we should use that moment to open conversations and to seek out help from a trusted provider.
Important advice. Dr. Sutton, thanks very much. If you or a loved one are struggling with thoughts of suicide, help is available. Call the National Suicide Prevention Lifeline at the number on the screen, or go to suicidepreventionlifeline.org for free, confidential emotional support 24 hours a day, 7 days a week.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.